Good morning, it's day 7 here, locked down in New Zealand.
Thank you if you've come back for the second time today. Now, it's Tuesday the 31st of...
So it's Wednesday the 1st of April, New Zealand. We're 24 hours ahead.
March. Over 800,000 cases confirmed in the world. We know the real number's way more than that. 38,000 deaths and 179,000 recovered. Now, the World Health Organization have been saying that it expects this virus to spread everywhere in Asia, including the Pacific countries such as Papua New Guinea and round about there. And I must say, I unfortunately agree with this assessment. I think they wanted to flag this up because the epicenter's focus is now in Europe and the United States, but it's at the same time it's spreading in the Pacific region and throughout Asia as well. Laos, Cambodia, Vietnam seem to have strangely low numbers of cases. Let's hope they are that low, but unfortunately they may well be higher. Now, the UK, we're doing a few more tests, so we've got a few more confirmed cases. Unfortunately, we're going to see a great increase in deaths over the next weeks, probably for the next 2 or 3 weeks. One thing that's really, I actually find it quite upsetting, the amount of food that's been wasted in the UK. So there's been all this panic buying and people simply haven't consumed the food. I've heard in my area there's been 200 tonnes of food waste. I mean, it's just terrible through panic buying. In the United Kingdom, we have no problem with food supply. There is no need for panic buying. And I think that's the same in the United States and other European countries. There's certainly in my country, no need to panic buy, and wasting food at this time is just really quite inexcusable. 9,000 patients in hospital with COVID, that's going to increase. Now, we have the lockdown, of course, in my country. So first of all, we'll expect the new cases to decline, then we'll expect the hospital admissions to decline, and then we'll expect the deaths to decline in that.
Yeah, so the same thing here in New Zealand. We're 7 days into it, so exactly what he's talking about. I think we're almost the same, or they're a couple of days behind us.
Order. But for now, it's still going up, and the government are expecting a surge in cases over the next few weeks.
Yeah, ours is about 650 going on 700, so we're going to hit 1,000 shortly of people that are infected. You know, some of those have recovered and they've passed it on. We're going to get a few health people who are treating and stuff like that. And obviously, if people break the quarantine and get out and are super spreaders, then we'll start to see it dribble on and we'll get some more people in the community.
So it looks like we're approaching the peak in the UK, perhaps in about 3 weeks' time.
So same in New Zealand, in 3 weeks' time we'll hit the peak. It might be a week's time earlier. So we're at 600. So it'll be interesting. So at the moment it's 600, 5 million New Zealanders, sort of 1 in 10,000 at the moment.
So the next weeks are going to be very difficult. Spain, a lot of more confirmed cases, and this is despite relatively low levels of testing in Spain. So obviously in Spain, the real numbers are going to be way higher than this. Last 24 hours, another 849 deaths in Spain. Terrible death rate in Spain. Great shortage of testing in Spain. And all over the world, why hasn't the world got its act together on testing? Virtually everywhere, with the arguable exception of parts of China later on, South Korea, Taiwan, have not been testing enough.
Now, let's get on and get our frontline people, our nurses. The reason that nurses aren't able to get rid of their student loans, have a freehold house at the end of it, these 800 people that pass away, from my perspective, they're the most important part of our community.
I had emails from Germany saying that they're not testing as much as the impression I gave yesterday. So really, the world has not got its act together on testing. This should have been done so much more proactively than it has been. Should have been flagged up 2 months ago by the World Health Organization.
See, I want to have an antibodies test to see if I've got it and had it, which is very unlikely, 1 in 10,000, so most people wouldn't have. That's why they're doing. But at some stage, and there's a reason for doing it. So let's do 10,000 people for every one person that has it. Why? Because then we are able to trace who a super spreader is and stamp it out. So we need to be doing testing, and it should be a priority of this government to get out there and test. And people who want to have a test, they should be able to be visited at their home, give a swab, and it goes through on a database and that sort of thing. Those that don't think they have the symptoms, but there are certain individuals that want to know.
The country should have been told, make huge amounts of tests, develop the antibody tests, because it's a real problem. We're still not testing anything like enough. Poorly people and people that are caring for other people can't get tested. I get emails every day from people in the UK who are working and yet think they might be positive because they can't get tested, sometimes working in the health service.
Yeah, and that's another thing. What they found is about 11% of the people that presented had the COVID, and 90 or 89% didn't. Now, when a health worker gets infected by one of the 10%, they're working for the next month, passing it on to the 90% in the health environment. Yeah, they might have the masks and bits and pieces like that. So this is something that needs to be looked at.
Which is concerning. Spain, nursing home deaths increasing, as we looked at in detail in the
And one of those earlier ones is the army came through and found a nursing home, and all the staff had fled away, and the invalid patients in the nursing home were just left 24 hours by themselves, no cups of tea, no food. And this is going to be a problem, especially in places like India, Africa. It's just going to be a challenge where people just walk off the job. I mean, if you had a choice on the first day, that's always my question in war, 5-year war. Do you want to be the first person to get shot in day one, or do you want to survive the whole horror of 5 years to be the last person shot on the last day?
In the last video, do watch the last video if you get the chance. It illustrates how vulnerable these people are in this care facility in the United States. The death rate was 34% amongst residents. Quite alarming death rates.
Yeah, so New Zealand's got a large number of old folks' homes, and so we need to do some real, make sure, that these are protected.
Increasing cases in the US. This is going to carry on increasing rapidly, partly because the numbers are increasing rapidly, partly because testing is being ramped up in the States. Over 3,000 deaths now in the States, most cases in the world. The President has said the next 30 days will be vital. And it's good to see that senior politicians in the States now seem to have a more realistic view of how long this is going to take. The comfort ship, I believe it's a US Navy ship, has arrived in New York. And the plan is that these ships are going to look after people with day-to-day needs, such as trauma. Because all the day-to-day medical...
I just heard news, the road I live on is on State Highway 1, and a truck turned in, and a car going south ploughed into the side of it. And then the other side of the road, just up the road, a truck and a car hit. So there's obviously need for trauma. They had to bring helicopters in to fly them out.
And trauma needs aren't going to go away. So the idea is that the COVID patients will be nursed in the hospitals, and the other patients could be looked after in this comfort ship. But the governor said New York needs to triple its hospital capacity. That is a big ask. Now, there's a facility being erected in Central Park. I think it's relatively small. I think it's about 80 beds. But it kind of struck me because we've got a tent, basically, a very sophisticated tent, but nonetheless basically a temporary hospital being erected in the middle of New York, in the middle of one of the most sophisticated countries on earth. And yet we're erecting a tent to treat people in. It really was quite a poignant symbol for me, and I'm sure if you're in the States you share that, the poignancy of that impression. New York, New York's a bit of an epicentre, of course, 9,000 current patients. A lot of deaths just in New York City. In New York, the peak could be in 2 weeks. So cases, deaths, it's inevitable they are going to be increasing in the United States. Quite inevitable. But let's hope this peak comes sooner rather than later. The medical officer in the state is expecting up to 200,000 deaths.
See, 200,000 deaths, I did a prediction for the council at 2% through the whole country would be 7 million deaths. So, as an order of magnitude, will it get to 999,000?
And that is if things are done well. 100,000 to 200,000 deaths.
That's if things are done well. The laissez-faire, with people travelling without being locked down and stuff like that, super spreaders travelling around, and the thing just gets longer and longer.
Things are done well. Just think what it could be if things are done badly. Italy, the numbers are still increasing, but the rate of increase is decreasing as the lockdown measures start to take effect.
So we see that there's 800, so they're getting up to 1,000 deaths, so they're pulling that number back and they're doing their bits and pieces. And then we go into the bits and pieces in the different other countries. I went and looked through on the website all the different countries, about 200 of them, and some of them have got one case. Holy See was a country I'd never heard about. Where is the Holy See? They got 6 cases. Put in